Hi friends, today we are discussing the important points related to cardiovascular system. In this part, there are 10 points and related informations we are discussing. So the first point, apex beat heard at fifth intercostal space. So friends, what do you mean by apex beat? Apex beat best described as the point of maximum impulse, which is in the furthermost point outwards and downwards from the sternum, at which the cardiac impulse can be felt. The cardiac impulse is the result of the heart rotating, moving forward, and striking against the chest wall during systole. It is also known as the apical impulse. So friends, the apex beat is also called as the point of maximum impulse and the apical impulse. So there may be questions like this where we can best assess the point of maximum impulse or the apex beat or the apical impulse. We have to know that these three terms are similar and we can be assess this normally at the left fifth intercostal space, so that the normal apex beat can be palpated in the precordium left fifth intercostal space at the point of intersection with the left midclavicular line. Friends, please note that in children, the apex beat occurs in the fourth rib interspace median to the nipple. So, if the questions for the competitive exams asking about the children, then the answer will be the fourth intercostal space. So, moving on to the next diagram, which will help you to understand more, that the star which is noted in the diagram shows the apex beat, where we can palpate or where we can inspect the apex beat. And friends, just take a screenshot of this photo, so it will help you to learn more about the location of the valves, the aortic arch, pulmonary arteries, veins, and the diaphragm. So friends, other than this, we have to learn more about the areas for auscultation to assess the cardiovascular system or the heart. For that, I will show another diagram. So in this area, there are 5 areas for listening to the heart. Means we can auscultate the 5 areas for the assessment. The first area is the aortic, which can be located in the right second intercostal space. The next auscultation area is the pulmonic area, and which is located in the left second intercostal space. And the third is the Earth's point, which is located in the left third intercostal space. Then comes the tricuspid area, which is located lower left sternal border in the fourth intercostal space. The last one is the mitral area, which is located in the left fifth intercostal space and medial to the midclavicular line. So friends, there may be questions from this also. That's where we can assess, where we have to find the area for F's point or the tricuspid or the mitral or the pulmonic and the aortic. So the answer should be the locations. And there may be a question from that, the S1 and S2 best heard at which point? The answer is Earth's point. If they are asking for the location, then the answer will be the left third intercostal space. So move on to the next point, that is mitral valve, which is located between the left atrium and left ventricle. We are all familiar with this point. However, we need to get some more information related to this. With the help of a diagram, I will explain about that. So friends, the heart has 4 chambers. 2 upper chambers means atria and 2 lower chambers means ventricles. Blood passes through a valve before leaving each chamber of the heart. The valves prevent the backflow flow of blood. Valves are actually flaps or leaflets that acts as one-way inlets for blood coming into a ventricle and one-way outlets for blood leaving a ventricle. Normal valves have 3 flaps or leaflets, except the mitral valve. It has 2 flaps. The 4 heart valves are the mitral valve, the aortic valve, the pulmonic valve, the tricuspid valve. So friends, the tricuspid valve, this valve is located between the right atrium and the right ventricle. Next to that, the pulmonic valve. The pulmonic valve is located between the right ventricle and the pulmonary artery. Then the mitral valve. This valve is located between the left atrium and the left ventricle. And we can see there are only 2 leaflets in the valve. So it is also termed as bicuspid valve. Then the aortic valve. The aortic valve is located between the left ventricle and the aorta. So friends, prepare some notes on how do the heart valves work. It will help you for getting better understanding about the heart valves and the chambers. So move on to the next point, that is positive anotropes increases heartbeat. The definition of positive anotropes is that an agent which will increase myocardial contractility by increasing the velocity and force of myocardial fiber shortening. Once again I repeat in the definition, that is a positive anotrope is an agent that will increase myocardial contractility by increasing the velocity and force of myocardial fiber shortening. So friends, here are some examples of the positive anotropes which are used for increasing the myocardial contractility. Example, dopamine, dobutamine, epinephrine, norepinephrine, digoxin, phosphodiesterase inhibitors, glucagon, insulin, amiodarone, and the negative anotropes which are used for decreasing the myocardial contractility. Example, beta blockers, calcium channel blockers, class 1A antiarrhythmics, class 1C antiarrhythmics. So move on to the next topic. Average weight of human heart is 300 gram. So friends, what is the average weight of a male heart? It is said to be that at the age of 61 to 78 years, the average weight was 345.9 gram for men and 285.1 gram for women. So friends, the competitive exams, if the questions is like this way, we have to answer a reasonable value. So moving to the next point, the closure of atrioventricular valve. The sound heard is S1 heart sound or the first heart sound. So let's see. The first heart sound S1 is occurs during the closure of the mitral valve and the tricuspid valve. It occurs at the beginning of the ventricular systole. That means when the ventricle contracts, the mitral valve and the tricuspid valve will close to prevent the backward flow of blood from the ventricle to the atrium. During that time, the sound heard is called the S1 sound or the first heart sound, and it is loudest at the apex and lower at the left sternal border. The first heart sound can usually be heard easily with both the bell and the diaphragm of the stethoscope. So move on to the second heart sound, S2. The second heart sound is produced by the closure of the aortic and pulmonic valves. The sound produced by the closure of the aortic valve is termed A2, and the sound produced by the closure of the pulmonic valve is termed P2. Like the S1 heart sound, the S2 sound is described regarding splitting and intensity, and it occurs at the end of the ventricular systole and loudest at the base. For the second heart sound, the diaphragm is used with the stethoscope, usually best placed at the base. So move on to the third heart sound. The features are is a ventricular gallop sound after S2, heard during rapid filling of the ventricles in diastole. The turbulent blood flow to the ventricles due to increased volume, and it is normal in children, young adults, and during pregnancy. And it is abnormal because there is a chance of associated heart failure, restrictive cardiomyopathy, and high output status. Then move on to the fourth heart sound, the atrial gallop sound before S1, heard immediately after atrial contraction phase as blood is forced into a stiff ventricle, and it is normal in healthy older adults. It is abnormal in younger adults, children, and it may associated with ventricular hypertrophy and acute myocardial infarction. So move on to the next point, closure of semilunar valve, S2 heart sound. We already discussed this point. So the next point is fasting period needed for lipid profile, 12 hours. So friends, we have to learn what are the contents, what are the tests included in lipid profile. It is cholesterol, triglyceride, HDL, LDL, and cholesterol is to HDL ratio. So, and HDL is known as the good cholesterol and LDL is known as the bad cholesterol. It is mandatory to learn the normal values of these levels because some of the competitive exams are asking the normal values of blood test results. Friends, find the normal value of very low density lipoprotein. So the next point, 24-hour echocardiograph. It is called Holter monitoring. Move on to the next point, P wave represent atrial depolarization. In this diagram we can see the P wave represent atrial depolarization, ventricular depolarization represented by the R wave, and the T wave represented ventricular repolarization. So friends, just make a screenshot of this diagram and know the normal values of the intervals and the different types of waves in the ECG. There will be another class related to the ECG, so that will be helpful for you. So let's move on to the last point, P wave absent, which represent ventricular tachycardia. So is the ECG, there is absent of P wave and it is ventricular tachycardia. Friends, so far we discussed the 10 points related to the cardiovascular system. They are: point number 1, apex beat heard at 50 intercostal space. Point 2, mitral valve located between left atrium and left ventricle. Point number 3, positive inotropic agent increases heartbeat. Point number 4, average weight of human heart is 300 gram. Point number 5, closure of atrioventricular valve is S1 heart sound. Point number 6, closure of semilunar valve is S2 heart sound. Point number 7, fasting period needed for lipid profile, 12 hours. Point number 8, 24-hour echocardiograph is called as Holter monitoring. Point number 9, P wave represent atrial depolarization. Point number 10, P wave absent in ECG means ventricular tachycardia. Friends, this is the end of this section, and I am Sonu Sudhakaran. We'll be back with a new video which will definitely help you to acquire newer knowledge related to the cardiovascular system.